To improve any type of mid-back stiffness, aches, pains within the mid-back after a long day of sitting, or again, if you want to work on that overhead mobility after you did the self-assessment at the wall we went over, grab your foam roll, all right, ideally if you have one. If not, take a nice big bath towel, roll that sucker up, and you could use that as well in the meantime, but I think you'll get the best bang for your buck using a foam roll. Joe is in the position that we call hook lying, all right? So he's got his butt on the floor, heels are up towards his butt, knees are bent. First and foremost, Joe is going to tuck his pelvis back and keep his rib cage down. What this does is kind of takes your low back or your lumbar spine out of the picture so that when we're doing this extension over the foam roll to work on your mid back, we're not compensating from the lower back. So a couple hand positions. Right now, Joe has his hands interlaced behind his back of his head, supporting his head and neck, which is perfectly fine. Pelvis has been tucked back, rib cage down. He's going to gently lean using the fulcrum of the foam roll or the towel, whatever you have. Hold for a second or two, and then do a small crunch to take off that pressure, leaning up. Good. Repeat several times, and then roll that foam roller half an inch to an inch up or down. Again, we're staying off of the lower back and off of the neck as well. All right, position number 2, same setup. Joe is going to give himself an arm over arm hug. So one on top, one on bottom. Perfect. You want your elbows lined up so that they're both pointing in the same direction on top of each other if you can. Pelvis is tucked back, ribs tucked down, and then gently leaning back till you feel a little tightness in that mid-back. Sometimes if you're really stiff, you might get a little snap, crackle, pop. As long as it's not painful, nothing to be worried about. It's perfectly normal to get little cavitations within the joint there. Again, do a few reps at that location. Move the foam roll up, move it down slightly, search for the new spot. Stay within the shoulder blade region, that mid-back region. Perform several times throughout the day, changing up your sitting position, changing up that crummy posture we all fall into to relieve some of that stiffness and improve your back mobility.